Okay, so hello everybody, very good evening, namaste. Welcome back to your another training session with me. I am Pragya.Vijh and we are going to have our training on psychoanalysis today. We'll be waiting for a few more seconds for our other friends to join us for the session and then we will begin with it. I request you to kindly subscribe to this page so that whatever upcoming final updates we have for further sessions, you can get it. Just waiting for others to join and then we will begin with the session. All right, so it's time and we will begin now. Hello, everybody. Very good evening. Welcome back to another training session with me. I'm Pragya.Vijh, your psychologist and a holistic healer. And today we are going to have our training on the topic of psychoanalysis. All right, a bit about myself before we begin with the session. I'm a psychologist and a holistic healer by profession. So I deal in child and adolescent counseling and I have expertise in the areas of anxiety and stress management also. I also help people to heal themselves through Reiki healing and tarot reading. And I've been mentoring more than 15,000 individuals till date now regarding how to cope up with stress, how to manage their own issues, how to overcome the issues in their life, and also how to be more independent and come up like a beautiful personality in your life. Okay, so to brief you people about what all we will be covering in this session, we are going to have this a short, brief introductory session on psychoanalysis, and I would try my best to cover all of this. We would be beginning with what do you mean by psychoanalysis in nature? Then we'll be moving ahead to what are the uses of psychoanalysis. So, if you learn this beautiful stream of psychology, then in what all areas of your life you can use it. Then we'll be moving ahead to the goals and objectives of psychoanalysis. What are the goals on which it functions? किन किन areas पे वो काम करता है? All of this will be covered. Moving ahead, we will talk about the roles and duties of a psychoanalyst, which are very, very important for you to understand. So, we'll be talking about the duties and the roles of a psychoanalyst, and then we'll be moving ahead to few techniques which were used by Sigmund Freud, who's called as the father of psychoanalysis, and how you can also use that in your training sessions or maybe when you're dealing with your clients. Now, before I begin with it, I would like to know any idea you guys have that what do you mean by psychoanalysis? You can use the chat box, the option of live chat. You can communicate with me through that. What do you mean by psychoanalysis? What all comes in this? Sigmund Freud, all right. Talk therapy, Unconscious mind, good. That's a nice one. Anything else? Good evening, very good evening. Yes, right. So, psychoanalysis has also been called as talk therapy because majorly this technique involves intensive communication between the client and the therapist. So in this therapy, it's more of the client who is telling about what all have happened with them, what has happened, how has it happened, and the therapist is the one who is quietly listening to everything and trying to understand that. So basically, it has more of talking part to be done by the client in this. Secondly, Freud developed this treatment for patients who did not respond to the psychological treatment available at that time. So basically, the time when psychoanalysis was introduced to the world, at that time, a lot of female patients, especially, came to Freud with symptoms that we are having these issues, but nobody is able to treat the cause behind it. For example, a lady would come and say that I have intensive pain in my arm, but when I go for test, there is nothing coming up in the reports. Or if somebody would come that I have extreme pain in my back or maybe in my legs, but there is no evidence for that. So that is the time when Freud came up with his approach called as psychoanalysis, wherein he said that in that a lot of times in your life there will be no medical or psychological treatment which would be available to you. You will not be able to trace from where your problem is coming, but that doesn't mean that the problem is not existing. It means that the problem is coming from your unconscious mind. There is something which is digged in deep into the unconscious part of your brain from where the issue is coming. Then Freud believed that a lot of types of your problems come from your thoughts, your feelings, and your behaviors, as I said, which are rightly digged in the unconscious mind. We know the three levels of our mind, right? The conscious, the preconscious, and the unconscious. So, to brief you about it, the conscious level of your mind says the level that you are aware of. So, for example, you are looking at this video right now, you're attending this session with me. So, you are consciously attending to what I am telling you. Moving ahead, the second level is called as the subconscious. Now, the subconscious level talks about the things that you know, but you are not aware of that right now. So, for example, if I ask you people, what is your date of birth? Write that to me in the chat. Or you can mention, what's the name of your best friend? Right. So, these dates and the names that you're mentioning to me, I'm very sure you were not thinking about all of this before I asked you right now. You were not thinking about your best friend's name. You were not thinking about your date of birth. Right? So that means it's a part of your subconscious. So basically, what I know but I am not thinking about it is lying in my subconscious, and whenever you want to retrieve it from the subconscious, you can do it. And the third layer of the mind is called as the unconscious mind, which means that it is not possible for you to recollect easily what is lying in that part of your mind, which is the unconscious part. Therefore, he said that your present is shaped by the past. So, what has happened with you since childhood till your present life, what all has happened with you, what all thoughts and feelings you have, they are digged in into your unconscious mind. And slowly and steadily, when you begin to work with psychoanalysis, as per Freud, आप उन चीज़ों को अपने unconscious mind से निकाल के अपने conscious mind में लाते हो. So, this is the basis wherein psychoanalysis lies. Is it clear to you up till now? Can I have a yes in the live chat? All right, moving ahead. Now we will come down to what all happens in the session of psychoanalysis. Okay, so number one, When you are doing psychoanalysis with any of your clients, or maybe you're trying that with somebody else, you have to meet with the patient individually. So you have to remember that we always prefer doing psychoanalysis in individual setup. We do not do that in a group setting. Reason being, it's a very, very intensive procedure which is to be done with individual attention. Okay, so if it is a group of 4 to 5 members who are sitting together, the client might become very conscious, because of which they will not be able to follow your instructions very well. Like if you're telling them to do free association, you must be knowing these terms, right? Free association, interpretation. So when you're doing these things with the client, they might not be in the right state to listen to and adhere to the instructions because they have a lot of people around them. So it's better that you meet the patient individually. Number two, the psychoanalysis sessions are held maximum for 50 to 55 minutes. Though many of the sessions of other therapies like behavior therapy, CBT last up to 40 minutes, but psychoanalysis is something which is much more longer and deeper in nature. So that's why you can hold like times a session in a week and maximum for 50 to 55 minutes. Do not proceed that. Then the third is that it encourages patients to self identify their emotional states. So basically, as a psychoanalyst, it is your work to help patients to identify what is happening with them, their own thoughts, their own feelings. We get more and more of awareness in the patient about their own thoughts and about their past life. And once you're able to do it, you can talk to the client about their problem, and then you can just dwell into the root cause from where their issue is coming. So let me give an example to explain. As I rightly told you that at that time a lot of ladies used to come to Freud and used to tell him that I have issues in my hand, I have pain in my legs, but they were not able to trace the cause. So how did Freud work on it? So Freud began with his techniques that I will be introducing to you after this now. He began with the techniques and he made the clients, the female clients, to think about their childhood. Majorly, Freud emphasized on the childhood of the person and the role of the mother. These were the two major areas he focused upon. Though a lot of times he is also, I would say, a lot of contradictions are there for psychoanalysis related to his conception of mother and for the sex part that he has talked about, the intimacy part. But Freud really believed that a lot of our desires and pleasures which are stuck in the unconscious are creating issue for you in the present. So when he began to do his techniques with the ladies at that time, he used to talk to them about their childhood, from where what all has happened with them, which areas of their life they feel are not so complete, and which part of their life they feel really hurts them till date, maybe something about parents or childhood. And from there, he used to extract the areas. So maybe a lady is coming to him with an issue that I have a lot of issues with maintaining relationships. I am not good with male counterparts in my life. And when Freud would begin with his treatment of it, he would be able to trace that definitely in past she did not have a good father-daughter relationship. Or maybe she was not good with the male friends in her life, due to which today she is having issues in maintaining healthy male patterns. So this is how फ्रॉयड यूज टू ट्रेस द पैटर्न कि कहाँ क्या गलत हुआ है जिसकी वजह से आज क्लाइंट को ये प्रॉब्लम हो रही है. So this is the way he used to work on it. So we have to dwell into the past, trace the cause, relate the cause to the present life, and then work on it. Okay, then moving ahead. Let's talk about what all issues can psychoanalysis treat. So it is Proven research wise that psychoanalysis can treat a lot of emotional problems and even psychotic conditions. Many of them can be touched by psychoanalysis, and they can definitely help with the part of medications also is required, but psychoanalysis treatment also works very well. So if you want to work upon anxiety, if somebody has anxiety issues, somebody suffering from depression, or somebody say that I have a lot of panic attacks, I have a lot of phobia issues, so then also psychoanalysis can really help it. Moving ahead, talking about obsessive behavior. Obsessions means that when we are too much after one thing and we are not able to think anything about else at all in my life, मेरा हर thought, मेरा हर action, मेरा हर behavior सिर्फ उस चीज को लेकर होता है. So that is called as obsession. If somebody has some obsessive behaviors, maybe towards a person or maybe towards some object, it can be dealt with psychoanalysis. Also, if somebody has a lot of trauma in their life or trauma related problems they are still suffering, then psychoanalysis can help them. So, I will give you an example of this. I remember years ago there was one case which came up to me for counseling, wherein I was able to see that the lady was good 70 to 72 years old now, and frequently she had the events in her life wherein she would date back to the time of pre-independence. So the struggle which these people had at that time, they had to leave their native places, they had to travel, there was a lot of violence around them. So she used to go back to that time mentally, so forth, and she used to tell her family members that, oh, अब fight होने वाली है, they are coming to kill us, we have to run. And the family member used to tell her that, Mama, there is nothing like that. But she would again and again connect to those areas or that time of her life. So these are trauma related problems that the client can have. Also, a lot of eating disorders like anorexia nervosa, bulimia nervosa, binge eating, all of them can also be dealt with psychoanalysis. And people who are having low self confidence, self esteem, or sexual difficulties, they can also be cured with psychoanalysis. So basically, almost every area of your life you will see can be dealt with this, because this is one of the very extensive approaches which talks about how your past is related to your present and how is it affecting your present today. So this is the relationship between your past and present called as psychoanalysis. All right, moving ahead with the basic goal of psychoanalysis. What do you think? What is the basic goal and objective of psychoanalysis? Must communicate with me through the live chat so that I can know what all are you people able to understand. क्या एक गोल है, क्या ऑब्जेक्टिव है साइकोएनालिसिस का? Curing unconscious problem, okay. Dealing with past, anything else? Cure the deep rooted issues, right? Kindly use only the live chat and not any other platform with me right now to know about the client's problems. Right. So basically, the objective is to help the patients understand the issue. क्या problem आ रही है, क्या issue आ रहा है, helping them understand that, and definitely then taking out the deeply rooted problems which are there. जो उनके अनकॉन्शियस में बहुत डीपली चीजें बैठ चुकी हैं उनको निकालना. One of the ways which he used is called as hypnosis. Today you can see proper hypnotherapy trainings are being run. They are there to dig out the causes which are lying in the unconscious. Okay, now moving down to few techniques which Freud used at that time. I'm going to brief you a bit about it. So number one technique is called as free association. He used free association extensively in psychoanalysis. So he stated that free association is a practice in this therapy wherein the client is allowed freely to share their thoughts, their ideas, and whatever is coming to their head. So, what is the idea behind it? Freud majorly felt that because it is not possible for you to reach the unconscious part of your brain, so one of the ways to reach it is that you can just sit down and begin to recollect the things which are coming in your head, and you have to tell them to the therapist. They might have some significance with what you want, and they might not have any such significance. But the major part is that when you're speaking, you might utter some of those things which is very important, and the therapist or Freud would catch it. So it's all about the way you have to speak it out. So let's understand how this procedure goes on. You can take a screenshot of this or please write it down. Now, he said that free association is majorly done in four steps. Step number one, you have to listen to the random thoughts with which the client is speaking. So if I'm the client, I may just lie down and you might just poke me with a question. Okay, tell me, how was your day yesterday? So I will begin with my part that I woke up at 8 a.m. I did this, I did that, then I went for a dinner or anything like that. And when I am describing my things, I might particularly focus on one person. For example, I'm again and again focusing on my father, or maybe I'm again and again focusing on food. So, this you have to catch very attentively as a therapist, that which is the area on which again and again your client is stressing upon. Number two, he also used the technique of slip, which is called as the tongue slips, wherein he said अगर हम गलती से कोई वर्ड बोल देते हैं जो हम वैसे नहीं बोल रहे, now that can mean that it had a very significant meaning. Okay, so one of the very big examples which Freud used was that in place of bar, if you use the word bra. Okay, so this is a tongue slip which has a very major significance. Why did you say the other word in place of the first word? So that means you are somehow connected to the tongue slip. And if such slips are often seen in the free association sessions, so that is a red alarm point for the therapist to catch. Secondly, he said that once you listen to those random thoughts of your client, you have to begin to join the dots. तो कहाँ से कौन सी चीज उन्होंने बोली है, किस चीज का कोई लिंक हो सकता है प्रेजेंट लाइफ से, यू हैव टू जॉइन द डॉट्स. So like I told you that I might be focusing much upon my fatherly figure, or I might be focusing much upon food. So you have to be very alarmed about it, that why is the client talking about food again and again. Maybe you can link it to some preference I have in my life, or maybe if I'm very particular about the food part, so maybe I'm very much possessive about my food patterns, and then it can be related to what more situations the client is talking about. Right. So I'll tell you one very amazing case study which I read some time ago. So that case study showed that there was a lady who really, hated black roses. Okay, so when she began with her emotional management sessions with the therapist, the therapist was able to see that whenever the word black comes, the client would become a bit offensive, or she would take a step back. So, when the therapist began to talk more about it, he was able to trace by his free association sessions, he was able to trace that years ago, when the father of the client died, the stepmother brought a black rose on his funeral and she threw it on the grave. So, the daughter, which is the client, she felt very disrespected towards the father from the mother's side. And since that day, she is not talking to the stepmother. And that led to her hurt and I would say, pain she had in herself for black color. And she did not use anything of black color, no black pen, no black paint, no black dresses, no black shoes. She hated black color. So you see how you have to join the dots using your expertise. Then, after this, you have to find the exact problem. That what is the issue coming up in my life? So maybe if I use the same experience, maybe because of my hatred towards black, now my today's problem is that the moment I see black color, I have panic attacks. I begin to feel I have a lot of discomfort. I begin to feel very uncomfortable and I literally hate black color. That gives me attacks. So this is my problem. तो क्लाइंट आपके साथ इस प्रॉब्लम को लेकर आएगा कि मैम मुझे ब्लैक कलर से प्रॉब्लम है वो देखते ही मुझे बहुत से इश्यूज होने लग जाते हैं और दे माइट कम टू यू विद इशू ऑफ इमोशनल मैनेजमेंट. You are the one as the therapist who has to sit down with those thoughts, do a lot of free association and stuff, and come down to the problem. And once you are able to understand it, then you have to reveal it to the client that what problem is happening with them and from where is it coming. So, psychoanalysis is something very, very in depth in nature. Clear up till here? Can I have a yes in the live chat, please? All right, moving ahead with the second most common technique of psychoanalysis called as interpretation. Now, interpretation is the communication which is done by the therapist of a hypothesis which you have in your head. So basically, interpretation of a defense initiates the process followed by the context and then you bring it to reality. तो आपने जितना भी ऑब्जर्व किया है what all you have understood in your sessions with the client, out of your observation you come down to your own logics and summaries. So how do you interpret all of that comes as a part of interpretation. So this is a complete area to be dealt by the therapist over here. You do the analysis of what all you have discussed and understood. You frame a connection between everything and then you imply that from where the problem is coming. So interpretation majorly talks about the unconscious conflicts which the client has and how are they emerging in his present life. What problems they are causing in his present life. जब आप इसको trace करते हो, that is called as interpretation. And then we come down to the another most commonly used technique in psychoanalysis called as transference. So, in psychoanalytic theory, transference is called to be the state wherein your client begins to develop some feelings for you. Now, there can be some positive feelings also and some negative feelings also. But we know that for every counseling approach, there is a basic principle which says that no emotional attachments are allowed in this process. It's a very formal setup wherein there is a therapist and there is a client, right? So in psychoanalytic theory, transference is when the client begins to project few feelings about somebody else related to the therapist. So maybe if the client becomes very emotional and they used to have a very dear friend called as Sonia, so in the therapist they will begin to see Sonia and they will begin to behave with the therapist as if you are that childhood best friend of the client. Number one, it is definitely not realistic. You are not the best friend. Number two, it is not logical. Number three, this creates a lot of problems in the session because now they will begin to expect few things out of you as a friend. You are no more only the therapist. They will have some expectations from you as a friend. So that's why when transference occurs, it is the role of the therapist to cut down the sessions. Otherwise, but in psychoanalysis, it is a complete different technique I'm going to talk about. Okay, psychoanalysis used transference in one of the ways to vent out the things. So Freud at that time said that even if you begin to have psychoanalysis, you can continue the therapeutic relationship a bit and then try to evoke the feelings. तो अगर client आप में अपना friend देख रहा है, let them evoke those feelings. Let them just keep on going on and on with those feelings. Because वहां से आपको कुछ ना कुछ related to their past जरूर मिलेगा which will help you. But let me tell you, this is not a very easy process. Transference can lead to a lot of catharsis, which is emotional outburst of rage, anger, distrust, or codependency of your past. So it is you who has to understand this and cater to it very, very carefully. But if you have done your intensive trainings in psychoanalysis, only then you can deal with such situations of transference. By the end of the session, I also have few gifts for you people and some very important information. I will just tell you that by the end of this. So transference is also multi-layered and complex in nature. All right. So transference can be an obstacle to the therapy because we if are not able to take up the session anymore as a therapist, you feel very offended that I'm not able to understand why is he putting these feelings towards me. It can create a very big obstacle in your therapy sessions also. So you have to be very particular of when transference is happening with you. All right, so that is all about psychoanalysis that I wanted to discuss with all of you. Now, I want you to be ready with your questions because within some time I'll ask you to post it all in the live chat to me. Okay, now moving ahead. The first gift of the day that I have for all of you is that I want you to catch up to your chat boxes now, and I am going to share three links of different social media platforms with you. Your role is that you quickly have to follow all of them and come back to this session and write D3 to me in the chat. I repeat it again, you just have to follow all of them, and I have pinned the message in the chat also. Now you can see you have to follow all the links, come back and write D3 to me. The first one who does that successfully for all the links will be getting a prize from our side later after the sessions end. So you have exactly 2 minutes for this activity and your time begins now. Quickly just follow all of them and write D3. So if it's a YouTube, you have to subscribe. If it is Instagram or Facebook, you have to follow the page. That's all. Good, good, good. I can see the D3s. Keep going ahead. One minute left. Hurry up. Then I have important update about your certificates. 1 minute left. Following all three is important, let me tell you. Jaldi se. Good, good, good. Okay, and by the time I would like to remind you that you have your last training left with me for this free psychological therapies webinar called as the School Counselor Program. We have that today at 6 p.m. Okay, so this is the last program that we will be having in this webinar. Okay, and the final update for your certificates. A lot of you have paid for these certificates with me, wherein like we had these total 6 workshops. So you had to pay 50 for each workshop, right? Many of you have already paid for the certificates to get it. Now, the important notification is that within 10 working days, you will get your certificates on the email ID that you have provided in the Google form to me. I repeat, in the email ID that you have provided to me in the Google form, you will be getting your certificates. But the important point is that if you have filled the form completely right and if the transaction ID is visible to me, only then I will be able to trace your payment. If you have put in some wrong transaction ID and if I am not able to trace your payment because of that, then it will be difficult for you to receive that certificate after 10 working days. So what you have to do after that, you have to send me the screenshot of your payment on my personal chat box in WhatsApp, and then I will be providing you your certificate. So if you have paid, don't worry, your certificates are paid with, you are very much safe with us. 10 वर्किंग डेज में अगर सर्टिफिकेट नहीं मिलता आपको, मतलब आपने कुछ ना कुछ फॉर्म में गलत फिल किया है, विच इज ओके, एंड you ping me on WhatsApp later and we will provide you the certificate. Anybody else who feels that right now I haven't registered for certificate but I want to do it now. So in the chat box of this session, I have put the Google form link in the pinned messages. You can see it is in pin also. There is a Google form link. You just open it, you fill all the particulars rightly as they are asked. I will get your form and within 10 working days you will get your certificates. So that is all for this session from my side. And now if you have any queries, you can write that in the chat box to me and I'm there to answer. सर्टिफिकेट्स हम अगेन रिमाइंडिंग 10 वर्किंग डेज के बाद मिलेंगे और अभी तक अगर किसी ने नहीं किया है उसके लिए पे एंड नाउ यू वांट टू सो यू कैन यूज द लिंक दैट आई हैव मेंशनड इन द गूगल फॉर्म लिंक इज देयर एंड देन you can pay for it and you'll get your certificates. Hanji, any queries about it now? Any doubts? And also, I would like to have your feedback side by side for sure. That how was the session? Did you people understand about basics of psychoanalysis? Would like to have your feedbacks also. The techniques are called to be as free association. Tongue slips is a very good technique for it. Interpretation can be done. The four-step free association, as I told you in the techniques, all of this can be done with psychoanalysis. And yes, if you want to go for hypnosis, then trainings in hypnotherapy are to be done to try hypnotherapy with your clients. Okay, so I cannot see any other query coming up, so I would just wind up with this session. Thank you, everybody. Make sure you're connected with me in those WhatsApp groups because you will be getting updates regarding your certificates and everything in that group itself. So be there. We'll inform you in the group once I have circulated all the certificates. And make sure that you are joining us for the next live session on school counseling within 15 minutes. I'll see you there. Bye bye.